We're here at the Health Innovation Conference 2025 at the Venetian in Las Vegas, talking to all sorts of leaders about the future of healthcare and health technology. Well, joining me now is one of those leaders. He's the CEO of Innovaccer, Abhinav Shashank. Abhinav, welcome.
Thank you so much for having us.
Thank you so much for sitting down with us here at this event. And I know you speak about the need for an open internet for healthcare. You are building that. What does that mean in practice?
The healthcare ecosystem from a technology perspective has been incredibly broken. We've had information sitting in silos for a really long period of time. And how it ends up manifesting in real life is that a lot of the informational lag is causing massive pains, $1 trillion of waste in healthcare. So what that has basically resulted into is that we now spend $5.5 trillion on healthcare, and our outcomes are nowhere as great as other countries. And a lot of that I think stems from the fact that we've basically trapped healthcare information in these systems and not let it flow freely for better outcomes for all of us, making healthcare more affordable, more accessible, and better quality of care to happen. So what we've basically taken as an approach is that if you were to open up a lot of the information that exists in these systems already, we've spent billions of dollars digitizing healthcare. If we open up that information and created what could be the modern open internet architecture, in healthcare, we would see massive reductions in the cost structures, in affordability, and better outcomes for everyone. So we've been working on that problem for the last 7-8 years now. We have data for 80 million patients flowing through the platform. Today, we hope it gets to basically all of America over a period of time, and that effectively results into better outcomes for each and every one of us.
I want to learn more about how that impacts patient, provider, and payer, that better interoperability that you referenced.
It's just going to be helpful for all of us. I think firstly, it's incredibly valuable to the patient at the heart of it. I'll give you a basic example. I had a knee surgery, planned. I broke my knee basically, and the time it took for me to go from a primary care visit to getting to a specialist was a 4-week period. And it was just information lag, that someone had to basically send a fax from here, that had to be received on the other side. They would basically read it out. And that entire process just took so long. And by the time I really got to where my surgery had to be done, my knee had basically worsened. It took basically so much more pain and effort, for the system to now take care of me. This is just normal, regular occurrence in healthcare, all day long. And we talk about how AI can basically transform healthcare. But if you don't really have an informational and data fabric that basically powers up a lot of capabilities that AI really provides us, nothing will change. We're just basically accelerating a bunch of what's happening already, just making worse processes worse. And so having a common informational fabric, something that basically connects all of these systems, making everything basically work together, it would just be so much pain reduced from the providers, all of the administrative burdens that have basically gotten to them. The cost to basically manage claims is going to reduce for payers, and effectively I think all of us are going to be for the better, because it's better outcomes at lower cost for patients.
What are some of the most transformative things that health systems are doing on Innovaccer's platform?
Last year, all of our customers combined bent the cost curve for Medicare, Medicaid, and commercial payers by $1.5 billion. So the benchmark for the spend versus where they basically ended up being was $1.5 billion lower, and the quality score of care was 13% better on everything. So you basically are spending $1.5 billion of less dollars on administrative pieces, and you're improving quality by 13%. That is what technology should be able to do. The technology in every other industry has been deflationary in nature. It's basically brought down cost, it's made things more accessible for us. In healthcare, not really. And so I think that's the entire intent that we've sort of really had, that we'll work with our customers. Technology should be a deflationary force in healthcare. It should reduce the administrative burden on providers. We have the most tired provider workforce in the country in generations. Getting basically these things to work actually allows them to do what they joined healthcare for, and basically gets like, I think, them back the joy of care that they've always hoped to basically achieve.
How do you see Innovaccer's platform evolving in healthcare?
I think over a period of time, we basically want to be like the largest context infrastructure for healthcare. Like I think as you think about healthcare AI transformation that's basically going to happen, there is going to basically be this compute layer which NVIDIA and other companies are basically going to sort of build out. There is the model infrastructure which like I think like companies like OpenAI and others would sort of take up. But none of this is actually going to work in real time scenarios. You saw the MIT study that 95% of the pilots in healthcare end up sort of or like any enterprise basically end up not working out. And a lot of the reason for that is that the context that is required for these things to work in enterprise settings just does not exist. So I think if for AI to really be effective over the next 3, 5, 10 years, you would need a large context infrastructure to basically be built. We've basically been on that problem statement for a period of time. Like we think like we are the largest context infrastructure that exists like in healthcare today. And like we want to basically make sure that once you have this context infrastructure set up, you solve more and more problems. So today we are basically solving like problems on population health, care management, but increasingly we are doing like more things like revenue cycle management, more things like patient access solutions, more things for payers on utilization management, as well as basically risk and quality management. So the number of things that we will do on the platform is basically going to increase quite rapidly over the next few years, because the incremental cost of innovation with an internet architecture really goes lower. So people should be able to innovate more. We should be able to open up the ecosystem so that third parties can come and develop more things on top of our platform. That's basically like a lot of our thesis for the next few years, that where we had like I think like 1 or 2 solutions on top of the platform over the last few years, we will have like 10, 15, 20 solutions like over the next couple. So that should accelerate the pace of AI adoption, also should accelerate the pace of AI-led transformation for our customers as well.
Let's focus on the next 3 years. In that time frame, what are you most optimistic about?
I think the administrative load reduction is basically like the biggest thing that we are focused on right now. Like it is incredible that the pace of inflation of administrative costs for us has been like in the 13-14% range, while general inflation like for the country has basically been in that like 3-4% range. If something is basically growing like I think like at 10% like higher points, you know, like that cost is compounding and it's close to $1.5 trillion like I think like at this point. Maybe in like 2 to 3 years where we are sitting, that could look like $2.5 trillion. Like, and if you could reduce like that burden, everyone will basically be for the better. Like the providers would sort of really be happier because they don't have to do all of the work that they did not, like they're not clerks, like they don't want to basically be typing away like I think like things. If you can remove that, like if you can make like care more proactive in general, those are the things that we are basically focused on right now, like the administrative transformation and like scaling up like the clinical and specialty care, like I think like models using AI are the 2 core things that we are very, very focused on in the next 3 years.
Any lasting message that you want to leave to our viewers and, of course, people interested in healthcare?
Yes, AI has incredible potential to transform healthcare. I think the next $1 trillion company like that comes out of AI is going to be like a healthcare business. But for all of that to sort of really happen, you need an open information architecture to basically exist. And that is where people need to be investing. Everyone is getting very excited about like point solution A and point solution B. But if we don't solve the highways, we are not really basically going to sort of really see the transformational impact that AI can produce. And that's what we are like most excited about with our customers as well.
Innovaccer CEO Abhinav, Shashank, thank you so much for joining me here at Health.
Thank you so much for having us.